Under the watchful eye of doctors and nurses, patients afflicted with kidney disease can maintain a normal life. But when the patient is a child, the emphasis on maintaining normalcy is even greater.
Enzo was diagnosed at birth with a blocked posturethral valve, which basically caused him to be unable to pee at birth, and it really wasn't noticed until the next day. And so ultimately he's had about 10 surgeries since then, fixing the posturethral valve, and they were hopeful, and I was very prayerful that his kidneys would come back and function within the first year of life, but unfortunately they didn't, and at 3 months of age they told me that they were going to have to remove both kidneys.
Approximately 1,000 children develop end-stage renal disease each year, making dialysis a certainty. But treatment requirements for children are much different than for adults.
The challenges in treating a pediatric dialysis patient come from the fact that they're so small or can be very large and are of many different sizes. So the equipment that's required to take care of them needs to be incredibly precise. The fill volumes and the actual machine need to be very accurate in terms of what they deliver and how we record that. Any small difference, which might not be of a significant clinical problem for an adult, might be very big for a small baby.
In an effort to provide a more convenient and controlled option, a home-based treatment system has been developed. This type of system, known as Home Choice Pediatrics, allows for minimally interrupted daily activities because treatment can be delivered while the child is sleeping.
Okay, night-night.
We use a Baxter system that allows for the flow of dialysis solution into the peritoneum via an abdominal catheter. There it stays for a set period of time, and using the body's own peritoneal membrane as a filter, waste products and water cross the membrane and then are drained out when the fluid is drained out of the body at the end of that set period of time.
In addition, an electronic data card records the results of each treatment. This crucial information helps doctors and nurses monitor their patients' progress remotely and is delivered by the parent either in person or via modem.
Dr. Goldstein can monitor us. We live in Corpus Christi. He's up here in Houston. Whether we're here or in Iowa or go on a trip, he can monitor us through this machine. During the daytime, Enzo can have a quality of life equal to any other baby, other than the medicines that I have to give him throughout the day. He's doing excellent. He weighs 10 kilograms finally, so hopefully we can get him transplanted soon.
The type of patient that's really the best candidate for peritoneal dialysis are really the whole group of pediatric patients. Of course, the decision to determine which type of dialysis is performed is made in consultation with the physician. However, patients who need to travel great distances, parents who can perform the therapy at home to allow their child to have a more normal lifestyle are really the best candidates for this kind of therapy.
For a parent, dealing with a child who has chronic renal failure is not easy. But as medical developments continue to improve, decisions concerning their child's treatment and overall well-being may become easier choices to make.